Welcome to my apartment in New York. A little dark out, so I have all the lights on.
2.5 years into the COVID pandemic, many of us are familiar with the pain and boredom of self-isolation.
And a lot of time on that couch, which is covered right now, so that I don't contaminate the couch.
But Mark Hall is stuck at home thanks to another infectious disease.
I was diagnosed with monkeypox. It looked like an ingrown hair. I really didn't think anything of it. A couple days later, there were 2 more in that same area. And I looked at them and I was like, wow, this is a little bit strange. I think that this might be monkeypox.
Those 3 spots multiplied and were then joined by a cracking headache and fever.
I know that I have to urinate, and I'm anticipating that, and I'm like crying going on the way to the bathroom. It was like so painful.
In early May, a cluster of cases emerged in the United Kingdom. Since then, the virus has infected more than 16,000 people in over 70 countries.
Monkeypox is part of a large family of viruses. They are DNA viruses. They're related to smallpox, which is probably the most well-known virus. These viruses have been around for a very long time. We know of human diseases caused by monkeypox since the 1970s.
Associate Professor Faseli Coulibaly is surprised by how quickly it spread.
It is spreading more than we have anticipated, more than we've seen before, but there's kind of good hope from what we know of smallpox that we can have strategies to eradicate it. We have eradicated smallpox. It may take time, and obviously binding very tightly to its target.
Monkeypox spreads mainly through skin-to-skin contact or touching contaminated objects, and occasionally through breathing in droplets from an infected person. Associate Professor Coulibaly says while people should be on the lookout for symptoms, there's no reason to be alarmed.
Monkeypox has had a case fatality ratio of about 1%. What we're seeing here, and that's good news, I guess, is that it's much lower than this. Currently, the disease seems to be quite mild and doesn't cause deaths in the vast majority of the cases.
Hello everyone from Royal Free London's South 11 ward, where I isolate for 10 days now.
That doesn't mean it's harmless. Harun Tulanay ended up in a London hospital for weeks after developing high fevers, chills and painful pox on his face.
It started with little bit pain, and then swallowing became a little bit difficult, and I switched to the soups only, and then a day later it was completely shot and I wasn't even able to swallow my own spit.
Harun says when he tried to seek help, he was dismissed, misdiagnosed, and then told it wasn't an emergency.
By authorities, it is not taken seriously.
So far, over 98% of cases have been among men who have sex with men.
Gay and bisexual men have been particularly vigilant about their health, and what they want to do is to be able to have access to the tools and strategies to protect their own health and to protect the health of their communities. And I think it's the concern about having those tools available which is driving fears and concerns here in Australia.
Authorities and health professionals have learnt a lot since HIV/AIDS began sweeping through the community in the 1980s. They're determined not to repeat the mistakes of the past.
It's really critical that the messaging that we give to community is credible and non-stigmatising. The risk we have if the communications is led by people who are unfamiliar with our communities is that they get the communication wrong.
I'm having a really hard time getting out of bed today.
When I got tested a few weeks ago, the city of New York was able to run about 10 people per day, and it would take several days for my results to come back. And one of the big problems with that is that there's a 4-day window of exposure to vaccination where you can prevent people from getting monkeypox once they've been exposed, but that whole window had already closed for everybody that I had had contact with.
There are 2 types of smallpox vaccines that can be used for monkeypox, but only one of them is available in Australia, and it can be risky for patients who are immunocompromised, like those with HIV, for example. It's currently only recommended for healthcare workers or anyone at high risk of exposure. It's also considered for anyone who's a close contact of a positive case. Health advocates are calling for the federal government to approve and secure a supply of the other vaccine, which is widely being used in the US and Europe.
What we're asking for is for a supply of the vaccine and then for ATAGI to recommend access to the vaccine for all gay and bisexual men who are at risk of monkeypox.
With Sydney set to host World Pride in February, there are concerns that without adequate vaccine supply, it could become a super spreader event.
We need to have these measures in place before summer and particularly before next February and March when Sydney hosts World Pride.
In a statement, a spokesperson for the Health Minister said securing supply and the relevant approvals for new vaccines for monkeypox was a priority. They said the TGA was yet to receive an application for the second vaccine option, but would prioritise its evaluation as soon as it did.
So today's kind of a rough day.
Mark Hall has been on antivirals for weeks, and he has to wait until his lesions heal to leave isolation. He says Australia still has time to avoid a widespread outbreak, if it acts now.
Some of the lesions are still bothering me, so I'm going to take an Epsom salt bath. Hopefully I'll be feeling a little better.
I think we can get a hold on this quickly. We still are able, I think, to do that, but if not, it's going to be a big issue.